getting your health and wellness questions answered at your doctor's office? Are you ready to take control of your health and well-being? Do you want the proper tools to set you on your wellness journey? Do you want to meet and chat with expert members of the healthcare team? Well, step into Real Time with Dr. Stacey. Hi, I'm Dr. Stacey DeGale, your personal physiotherapist and wellness consultant who wants to make sure that you live your best life. We'll be chatting with wellness team members and inviting you as you are the center of that team. And we'll be doing all of this while you are in the comfort of your own home or office. Join me in Real Time with Dr. Stacey as we discuss everything health and everything wellness. Hi everybody, this is your favorite physiotherapist here, Dr. Stacey DeGale. I'm so happy to have you back with me on Real Time with Dr. Stacey on our men's health series. We're talking about real men, real health issues, and having real conversations. So this is your opportunity to add value to your life by learning, by being educated by our experts. And for those of you who have been following through over the last couple of weeks, we started with a bang with Dr. Sanjeev Parasram, followed by Dr. David Richards. And today we have Mr. Dylan Thomas. We'll talk about the Mr. Some people wonder, is a doctor or a Mr.? We'll talk about the little variants there. But I want us to, for those who are already online, share the live, share the knowledge. This is not just for the men. This is for all of those who also love men. So all the ladies, all the wives, the sisters, the aunts, this is also for you, because sometimes we are the ones who have to drag the men to the doctor. But today, again, we are focusing on the spine, the backbone of our bodies. Without a spine, can't function, we cannot do anything at all. And for some reason, gentlemen, you all know yourselves. Sometimes you have back pain or you have some back issue, neck issue for weeks, months, years, and you're not seeing about it. I don't want to say you're afraid, because we don't have any fearful men out there, but you need to see about your health before it is something that cannot be managed and managed well. And this is why we are here today focusing on the spine with Dr. / Mr. Dylan Thomas. So I'm going to bring Mr. Thomas on screen. I'll tell you why I want to bring him on screen. Remember, I said to you guys before, we have experts right here in Trinidad and Tobago. We don't have to go far. We always believe better is outside. Better and best is right here. So Mr. Thomas is the only consultant complex spine and scoliosis surgeon in Trinidad and Tobago. He earned his initial medical degree from the University of the West Indies and completed 8 years postgraduate orthopedic residency as well. He then pursued advanced specialization in complex spine and scoliosis surgery in both adults and in the pediatric population or children. He committed to over 10 years of extensive training at the Princess Elizabeth Center under the tutelage of Mr. David Toby. Listen, for those of you, most of Trinidad will know this name. Most people who have ever had a scoliosis or a curve in the spine know the name Dr. Toby. And Dr. Toby mentors special people. You don't mentor anybody from just off the street. And I'm so happy to acknowledge that Mr. Thomas has raised that flag and acknowledgement to Dr. Toby, who is a pediatric and orthopedic and scoliosis surgeon par excellence. Mr. Thomas has had years, even though you're not looking like years, he has had years of operative fellowship in the United Kingdom at the prestigious North Bristol NHS Trust and Southmead Hospital, as well as Bristol Children's Hospital, where he focused on spinal innovation, complex revision, spinal surgery, and cutting-edge technology, including robotics and reconstruction. He is passionate about what he does. So, Mr. / Dr. Thomas, welcome to Real Time with Dr. Stacey. And Feel free, introduce yourself to those who are listening.
Hi, thanks, Dr. Stacy, and good night, everyone. That was a really good introduction. I'm just here to have a nice chat with you and Trinidad and Tobago, and we'll educate the public, and so they will know that they could seek spinal surgical care or spinal care, with regards to physiotherapy and rehab too, right here in Trinidad and Tobago.
And you see, I don't plan what and ask the doctors to say this or say Y or B, but every physician, every specialist that I've ever had on this show acknowledge the value of rehab. So we'll come to that later on. So thank you for that plug. Now, Doc, before we get into it, explain to the people the difference and the acknowledgement with doctor and Mr. Because there's some people who get annoyed if we don't say the Mr. So just give us a little history about that. Somebody already messaged me and said, what's the difference?
Well, basically, a doctor is a professional who holds a title based on if they did a PhD or if they did a medical degree. And a Mr. or Miss, basically when a doctor has further his or her training in the United Kingdom or Europe, they get the title of Mr. or Mrs. or Miss. The history behind it is long ago, you didn't have to be a doctor to be a surgeon. In that era, you were an apprentice and your mentor would teach you how to do surgeries, and mentors were misters, right? The average Joe. And even they used to call them the barber surgeons. But as time progressed, they realized that a surgeon should have a medical degree to know the anatomy, physiology, pathology, and all that to be even a better surgeon. Yes. But in the United Kingdom and in Europe, they kept the title to distinguish basically surgical doctors from medical doctors. The Americans keep the doctor title all the time. But we wear it with pride, But I don't take offense if a patient or colleague calls me doctor or mister, but I like the mister. But there are lots of misters in Trinidad and Tobago, and this talk is about misters, right?
Correct. So we're in good company. Thanks for that clarity. So, there's so many medical pathways, so many specialization pathways. Was there ever a moment in your career that really hit home as to why you're delving so deeply into complex spinal issues?
Well, basically, I always had a passion for the spinal part when I was introduced to it when I was an orthopedic resident. But I also spent some time in neurosurgery as well as an acting registrar. It was my first registrar posting actually in the public hospital. But the nice thing about spines is the complexity of it. You have a mixture of both physical structure in terms of the anatomy, and then there's also the delicate structure of the nervous system and spinal cord. So it's a balance of complicated anatomy. You have little or no room for error. You have to know what you're doing, surgical-wise, and even planning for surgery and even the execution. Yes. And you have to have a lot of concentration throughout these procedures because they tend to be long. But I'm an advocate for once you train well, once you understand what you're doing, and once you're passionate with what you're doing, a combination, you will tend to have, and you get the patient and the relatives, which is also important. You have to meet their expectations and explain everything to them and break it down. And once you have that multidisciplinary team effort, patient, relatives, and the medical professionals and the physiotherapists and rehab, you tend to get a very good outcome despite the complexity of the surgery. But you must explain everything to the patient so that they will understand and have realistic expectations.
Yeah. And you said something there that just struck a chord. There's a little controversy happening right now on social media where a particular healthcare professional said that you only need this to manage diabetes. And you said something there about the team. And for effective management, especially of spinal issues, there has to be a level of team approach led quite often by you, the surgeon. So I'm so happy you put that plug out there, but we'll come back to that if we have time later on. Doc, and why do you think so many men in particular ignore back pain?
I think it's a combination of cultural. Men, as you know, men are protectors, providers, the traditional sense of the word, and then we in Trinidad and Tobago. And men don't like to look, quote unquote, weak
Yes.
in front of the ladies. So it's a cultural thing. Men, they have a strong front, they want to show that they're strong, and they tend to delay before they seek any type of medical or surgical care for the most part. It's a cultural thing. And also, I think it's part genetic because I think men and women are wired in special ways, down to the DNA and down to what DNA we inherited from our forefathers and ancestors. So I think it has a component there as well. But it's mainly cultural because we are thinking beings, all of us. But the cultural part tends to take precedence.
Precedence, agree.
Yeah.
But men, this is your opportunity. Get ready to ask your questions, to take control, and not to wait too long before you address your back pain. Mr. Thomas, let's say a man wakes up one morning with back pain. How does he know whether it's something he should go to the pharmacy and get some Ulfen, get a rub, get a crack, or come to you? Tell us and walk us through what a man and anybody with back pain should look out for to indicate, you know what, this is something I actually need to get checked.
Right. That's a very good question. Back pain, if it's, I'll say two things to think about. Red flags, right? And if the pain is severe and not going away. So let's start with the red flags. So any back pain that involves your bowel or your urine function being affected, you have strange sensation, different sensation by the private area, private parts, or you have associated weakness, new onset weakness in the legs or feet or lower limb. Those are some common red flags that you should go and seek care by a spinal surgeon. As well as the pain that is severe. So you take the Ulfen, you wake up with some back pain, you rule out a soft mattress, which is also a common cause of back pain, right? Because musculoskeletal back pain is very common. So providing that you have a good mattress, a full mattress, you wake up with back pain, you get over-the-counter drugs. You try it for a few days to a week or so, and it's relentless, it's not going away, and severe, also seek care. So that's the two main categories, red flag symptoms, and if the acute pain or short-term pain is not going away despite over-the-counter medication. I'd also even put in chronic back pain that is not going away over years, so you should get that checked out as well.
So someone just asked, they said, things tight. I'm not going to even say who sent me this WhatsApp. They said, things tight. If you work in a strenuous job, can you give an example of what first aid we can do for the back? And how long after that, if there's no improvement, should we seek further attention? That's a question via WhatsApp.
Okay. So back pain received on the job, I think, well, first of all, is the person or the patient able to walk, stand, and mobilize with the back pain, meaning that they have weakness or not in the lower legs or extremity. So if they're able to walk or they're ambulatory, they should go and seek care by the GP or local health center. Providing there are no red flags, you could also seek care by a physiotherapist as well for assessment and for initial management as well once there are no red flags. If the pain is severe and the plus or minus red flags, you go to the nearest health institution and seek care.
What, something you mentioned that struck a nerve. How important are things like body weight, physical activity, sleep, and general fitness. And when we're talking about long-term spine health, because we're looking at our populations now, and Dr. Parasram in the first episode and Dr. Richards in the second mentioned we are seeing persons who are not just overweight, but we delving into the obese. We're looking at men in particular with a lot of the extra adipose or fatty tissue surrounding the tummy. I used to call my daddy, my brother used to call my daddy Buddha as he got older. The belly got larger and larger. Can you go into a little more detail as to the importance, or is it important, the things like your body type, body weight, your physical activity, etc., on managing back pain?
Okay, let's start with body type. Basically, we are biomechanical beings, and our spine and our height could take a certain amount of weight, like any structure, whether it's a table, a chair. Once we exceed that weight, and I have a simple rubric, basically make sure your tummy is in line with your waistline or your pants belt. Don't let it overlap. So no fancy calculations like BMI. You keep your tummy in check with your waistline, because the additional weight puts stress on your spine, and we cannot stop time, so we age over time. But however, if we put more load or weight on the spine, it could cause deterioration and degeneration. And there are many studies in the literature shows weight contributing to back pain and degenerative issues. So basically, to keep the weight down, exercise, diet, strengthen up muscles, and not adding on additional weight over time unnecessarily. As we get older, our metabolism slows down. So naturally, our bodies want to put on weight. So we have to be more mindful to follow a diet. I want to say diet, not a crash diet. Basically, just eating the normal calorie limit for your age and for your gender or sex, right? To keep the weight off. With regards to job type, that also is important. We in Trinidad, a lot of us work in offices. A lot of us have to face traffic every day. We have to think about all these things. We spend hours in traffic, sitting, right? And then we're in the office and we sit. And then we come home tired after work and we sit. And then we sit on low seats, soft seats, couches that are not good, especially from a physiotherapy perspective for our spine. And that additionally, sitting is putting additional load. It's a force magnifier. It puts more load on the spine, which causes further degeneration. So it's like a cycle of misery, right? So both the employer and the employees, we have to think about from a holistic picture, from an employer standpoint, hybrid systems, work from home, or encouraging proper work and ergonomic setups in the workplace, places to exercise, proper nutrition in the workplace, be guided by the doctors and the therapists, right? With proper work-home life balance as well. So encourage, and then from a government level, reducing traffic in the mornings and afternoons. So you have to think about it in terms of a holistic picture from the government level, from the Ministry of Health level. You have to think about it from the employer level, and then you have to think about it from the employee level with regards to sedentary work-life balance. In terms of the more physical job types like the laborers, yes, when the supportive structures, working on the core, hydrating well, because muscle fatigue could cause muscle strains and muscle tears. Proper bending and lifting mechanics, which I know the physiotherapists know all too well. Taking guidance from the physiotherapist with regards to extracurricular and recreational gym activity. That is important too. So I often tell patients, before they get back to the gym, see the therapist, and let the therapist guide you on how to go about and what exercise to go to the gym. That's very important, because Trinbagonians often think the gym instructor is a physiotherapist, right?
Correct.
There's a role for chiropractors too, but make sure they're certified. And massage therapists too, make sure they're certified. With regards to fatigue, rest, sleep, it is important for all of us to get adequate hours of sleep, because we reduce cortisol levels, we heal, during sleep time. So sleep also is very important. So in terms of, just to summarize, body weight, keep the weight to your height. Diet and nutrition is important. Healthy diet, eating lifestyles, not too much junk food all the time. From a national level, in terms of ministry, from a workplace employee perspective, reducing traffic, hybrid systems, work from home when possible, and proper work setup with ergonomics and exercise equipment in the workplace is important. And also for the laborers, proper bending and lifting mechanics, extracurricular activity, proper gym instructions from the physiotherapist. And in terms of proper hydration, we're in a tropical country, water, coconut water, salts, and getting proper rest and sleep. I hope that summarized more or less.
Definitely. And you said something that is so vital, and countries such as Japan, they're so far ahead of us. They're at least 20 years ago in many companies in Japan, it is mandatory that employees take breaks throughout the day from the computer. I know of one company in Japan that had automatic shut-offs off of the computer. So you could be in a jam and trying to meet a deadline. They would shut that off for a few minutes for you to get up and move. They would have Tai Chi and other types of exercises at some area in the company, in the building. It was designed to ensure that people could work optimally. And when if you sit for extended periods of time, you have higher risk of developing non-communicable diseases, NCDs. When we talk NCDs, people think only diabetes, hypertension, but back pain is an NCD. So we have to remember the value. And actually, working from home, great idea, except we had persons with COVID-19 unprepared to work from home. And so they were doing work from their couches, doing work from the kitchen counter. So hopefully by now, I know Atlantic LNG, for example, I have no shares in LNG, but I know because having some patients from LNG, they actually provided small grants for some of their employees to create and make sure they had a good workstation at home. So you pointed it out, you still have to have good workstations and get up regularly from sitting. So you summarize perfectly. Now I want to talk about the modern man, and I made a note of that. We have men, and we mentioned it, either sitting all day. You mentioned it, driving for hours, working physically demanding jobs, lifting heavy, playing sports, and sometimes doing absolutely nothing for 6 days. But on the Saturday or the Sunday, they become an athlete. So, so from your experience, are there some common mistakes that men get themselves into in the gym that can contribute to neck and back and other spinal issues? And or is it just the lack of consistency? What do you think about that?
I think it's a combination of both. Weekend warriors. I sometimes fall victim with the playing sport on the weekend, but you have to do either stretching and some type of cardio during the week, so that when you on the weekend, when you exercise and you put out more, you don't strain muscles. I think it's a combination of what you're saying.
Yes.
I think in the gym, well, once again, it have a little bit of the machismo. There are other men in the gym. Sometimes there are ladies in the gym. Guys want to impress both the men and the ladies in different ways, right? And if they don't have a guided instructor or a squad partner, what they tend to do, they try to push too many weights, bad posture, bad mechanics, and it results in injury and damage. So gym instructors have to continue to take their work seriously and guide the attendance properly. And once again, I re-emphasize physiotherapy guided, so that they will know to do the activities properly. More reps than weight, lighter weights, and proper mechanics in the gym. And then not everyone, as we get older, you don't have to be a muscle-bound person. So, the people have to study what should be the best physique for the body type and not necessarily bulking up with, artificial drugs and just trying to get a look. But I think it's a combination of what you mentioned, to be honest.
Someone has just asked Mr. Thomas about deadlifts. They said everybody's telling them stop deadlifting, but when they deadlift, they have no pain. We always hear about deadlifting. What are your thoughts about deadlifting?
Well, once again, it's going back to the weight type. If they're wearing the belt, if they have a squatting pad, and if they're doing the deadlifts free or with the machine. Or once again, is more reps than the weight, and also be guided by a gym instructor and physiotherapist, because you might want to deadlift X amount of weight and get a disc herniation because you just try to lift too much weight in an improper way.
Yes. So again, everything is to be done with reason, listeners.
Correct.
Everything, and when you're increasing weights, you do so gradually.
Yes.
Unless you're going to be training for the Ironman, you're not going to start training for Ironman that's happening next week and start training today. It would have been a process. So even then, it has to be gradual and just being consistent. Yeah.
Yes.
So again, important. Mr. Thomas has mentioned the importance of gradual loading, of nutrition, of rest and sleep. Yeah. And as my mother would say, common sense make before book. So sometimes we know what we're doing,
Correct.
But we want to overdo.
Correct.
We want to overdo. Somebody asked a very important question. I want to hear what you say first before I cloud any judgment. With regards to leg pain, this person is saying they're experiencing sciatica symptoms. How serious is that? And what should they do?
Well, as I said before, sciatica is to see if you have the red flags or not. I always defer to that, and the severity of pain and the chronicity or the length of time you have in the pain. Sciatica without red flags, you go to either a physiotherapist or your local health center doctor or your GP for initial assessment and treatment plan. If the sciatica is associated with red flags, then you level up the care. You go to the nearest accident and emergency or specialist based on the type of red flag it is, or the physiotherapist. Let them get an initial assessment. So once you have sciatica, I think you should be assessed by a doctor or a physiotherapist initially, no matter what, and then take it forward from there.
And I would say this to this person who asked this question, that many a time when we assess the patient, we realize that they don't have sciatica. Not every leg pain is sciatica.
Correct.
This self-diagnosing we like to do, and this going on Google, Dr. Google.
The worst thing. Yeah.
The worst.
The worst.
I had a patient years ago when I was at Petrotrin who came in with a binder, this thick, saying that she thought she had a brain tumor. And she gone to multiple people, and I simply took the binder. I said, have a seat. I took the binder and I threw it in the bin.
You're right.
And she was in horror. I said, let's start from scratch. And it was simply cervicogenic headaches. She was having headaches coming from the neck. And after 3-4 sessions, good to go. Dr. Google is not your friend. It's good to get information, but go to the professional who will give you salient, evidence-based information. Okay, guys? I always preach that, yeah?
Same thing with back pain. With the differentials, there are many differentials for back pain and leg pain, and it doesn't necessarily have to be nerve-related.
That's right. And why it's important, again, to see the professional, especially somebody like Mr. Thomas, they are able to differentiate using a variety of methodology to see if your pain is really coming from your spine, because you can have what we call referred pain. So, Doc, as I mentioned, you tell us what referred pain looks like and give us 1 or 2 examples.
Yeah, referred pain originates from another organ or viscera, and or even though it's the source is in location A, you feel pain in another location or location B. So certain diagnoses like appendicitis, patients with kidney stones or gallstones and stuff, pancreatic or tumors, these pains originate from an organ or viscera in the abdomen. but the pain goes elsewhere. It goes to your back, it goes to your thigh, upper back, lower back. It could run down to your groin. So there are several differential diagnoses of back pain that does not really originate from the back at all. So that is what referred pain is.
Correct. And this is why it's important, especially if the pain is not going within a reasonable amount of time, that you see your professional to make sure you are treating what is actually causing the problem. We have a question. I think you answered it in a way, but I think this person just came on. Hi, Mr. Roberts. Thanks for joining us as usual. And he asks, is it normal for a back pain that comes on with strenuous work and goes away after a couple of days?
Well, it sounds musculoskeletal, but once again, we don't phone diagnose or virtual diagnose. The mere fact that when you do activity, it comes on, it is an indicator of mechanical or musculoskeletal back pain. But in a case like that, you still need the assessment from the professional first. And that could be an indicator that your muscles or your musculoskeletal system is not strong enough. Because if you're doing the same or more or less the same type of job every day, but you're getting pain over and over, to me, it should be investigated. So with that, seek the advice from a health professional, visit them, and get assessed with that.
Yes. Mr. Roberts, I hope you are happy with that. Check me later, call me tomorrow. It's one of my parishioners, my fellow parishioners and in Point Fortin. So, somebody just mentioned you have a surgeon. The surgeon means surgery. Sometimes I say, okay, I'm going to refer you to this neurosurgeon or this orthopedic surgeon. So, Mr. Gill, that means I have to have surgery. So in other words, the seeing a spinal surgeon automatically mean that someone needs surgery. And what factors do you consider before even recommending surgery?
Okay, very good question again.
And do you consider before recommending surgery?
Right. The answer to that is no, not because you see a specialist or a super subspecialist, you need surgery. However, if the professional refers you to a spinal surgeon or a neurosurgeon, there's a chance that you may require surgery because basically the primary care that they did, it has not been alleviating the symptoms, or from their assessment, they have realized they need to escalate this patient to the subspecialist. With regards to the other part of the question, the specialists such as myself, the subspecialists or super specialists such as myself, from the assessment, which is a clinical history, an examination, necessary investigations to be ordered, such as X-rays, CTs, MRIs, blood tests, etc., DEXA scans, and then a diagnosis would now be entertained. And the diagnosis, everything must tie in, right?
Yes.
Everything must come together. And only if, after the evaluation, the holistic evaluation, that everything points to a surgical solution, usually, I would, not usually, all the time, I would assess if this diagnosis could be treated primarily with non-surgical measures. So even though I'm a surgeon, I never rush to do surgery unless it's an emergency or urgency, right? If it's a condition that may be amenable to physiotherapy and medications or injections, I would refer now back to the therapist, right? For that first line or conservative trial. I call it a conservative trial. And the conservative trial is a combination of physiotherapy and certain medications, vitamins, etc. And sometimes, I would say probably like 50 to 60% of the times, once it's not an emergency or urgency, the patient gets better if they follow the instructions from the therapist and the doctor, to be honest.
Simple.
But they must go to that professional too, because sometimes people go to Dr. Google and try their own thing and it doesn't work. Yeah. So with my question, I make sure patients are usually truthful to the doctor. So I ask them if they really try the weight loss, the physiotherapy, and the medications or injections. And if that trial fails, then the therapist now will send back, or if red flags come about, The physiotherapist now will send the patient back to me, and then I will go through the scenario and then work the patient up for the operation.
Yes. So it's not, you hear some people say, that doctor just likes to cut. This is the reality is the majority of surgeons in any specialty, they're not just standing there waiting to cut. They want to ensure that you exhaust all the what we will call in physio conservative management, because sometimes that conservative management gets you better. And having dealt with Mr. Thomas with his patients, he's one of those that I could say without fear or favor that it's not about cutting, it's about getting the patient better and exhausting the conservative unless it's an emergency or if things are worsening. Yeah.
Correct.
So what makes a spine complex? Because your title is the consultant complex spine and scoliosis surgeon. What do you mean when we're talking about a complex spine?
That's a good question again. Well, first of all, we should ask what is the difference between simple and complex surgery? Because as we know, there's a little bit of an overlap. So some orthopedic surgeons do spine surgery, some neurosurgeons do spine surgery. But what makes me different from the rest of the surgeons is the complexity of the surgery. So other than the training that you have explained and the time frame, the 10 years exclusive. So basically, yes, I have done spine surgery and orthopedic surgery for a lot of years, but I realized the spine is a complex organ, and the spinopelvic system you need to put time in, you need to put plenty training in, and that's why I basically designated my work life to spinal surgery and complex spine surgery. So I've been doing spine and complex spine for the last 10 years exclusively. Wow. Other than all the credentials and all the letters that the patients will see, all those letters mean something. MBBS, DM, MRCS, FRCS, FACS, and the list goes on and on. But the one that I'm most proud of is the DM, which is the local training program, as well as the fellowship in complex spine in adult and pediatric. That one is very important. And it's a registered qualification with the Medical Board of Trinidad and Tobago and the Royal College of Surgeons. Yeah. So those credentials mean that Mr. Thomas did his necessary diligence and trained in operating in complex surgeries in adults and pediatrics over years. Let's start with that one. The surgery itself, complex spine surgery, usually involves implants, using implants to reconstruct the spine. And implants are usually made of metals or special plastics or alloys, and not from bag one thing, but medical grade implants, screws, rods. Trainees like to say pins and plates, but the screws, rods, plates, biomaterials. But putting these implants, these metal implants, screws and rods, and reconstructing the spine takes a lot of delicate. You must know what you're doing. You must have a 3D orientation in your mind. You must use devices to confirm where you put these implants in. And this is not done overnight. Hence the 10 years plus doing spine and complex spine surgery. So the complexity of the spine involves usually multiple levels of the spine, whether it's from occiput to cervical, which is base of skull to neck, or the neck to the upper back, or the upper back to the lower back, or basically the back to the pelvis. So from the website, you'll see pictures of trainee patients I've operated on, copyrighted. So people could actually have a visual of these implants that millimeters, there's really little or no margin for error. Because the nerves and the spinal cord are millimeters away from the bone that surrounds it to protect it. So if you don't train properly to do it, then you could paralyze. You could paralyze people, right? And you could damage nerves. So what I'm saying is that I am happy to say that I trained, I put in the time, the effort, I had support from my wife and kids, and from good supervisors who encouraged me when they realized what I like to seek it out there, and proper tutelage and whatnot. But I am very proud to say that I spent the time, I have the qualifications, and I have everything registered with the medical boards, so that what I purport to do, and from good relationships with colleagues, they know what I could do. So it's not, a trying a thing.
A trying a thing.
A trying a thing. It's not a trying a thing. It's that when you go to Mr. Thomas, he doesn't rush to do surgery, but if he has to do surgery, you're in good hands with this compassionate doctor who's well trained and fellowship trained in complex spine procedures, using a lot of implants, cutting away bone, because I usually have to break bone at multiple levels to reshape and restructure a spine too. So you don't want to paralyze anybody when you straighten that spine a bit, or, So yes, I'm happy to say that I trained extensively in it, and patients must do their research. They can research with the medical board. They could go on the website. They could do the research on patients. Ask the surgeon, did you do this before? How many times you're up for the week? What are your outcomes like? These are important questions to ask. Yeah, very important. So other than looking at even qualifications, which are important, do your background. Talk to your physiotherapist. Do you know this doctor? How are his outcomes? This doctor trained for how long? You might have a neighbor, a friend, somebody. Do your research on it, as well. I encourage patients to do the research and ask the doctor the relevant questions. Sometimes it might take a little offense, but you shouldn't. You must always be open, honest with your patients, and just tell the patient the truth. I have done this procedure already. I have not. I think I should send you to a colleague who is accustomed to doing it. Right? So once the patient asks the relevant questions, I think they will get. The doctors have a Hippocratic oath to be honest and truthful with the patient. So, yeah.
That is excellent advice. Even as a physiotherapist, I now have a pelvic health physio who comes twice a week to see those patients to me, because that's not my specialty. I'm not going to have you hanging on a string and just tagging you along. But I can say that your training is really extensive. I have difficulty putting a table together. I ordered a table from Brand Source yesterday, and it took me about an hour and a half for this little table. Everybody has their place, and you are gifted. Your hands are gifted. And this has nothing to do with the topic on hand, but I have to give you real props. You said, you spoke about the mentorship that you've had, the experience that you had, and the support, but you also mentioned your wife and children. So that is real props to you. So we really have a mister in our midst. So thank you for that, because you couldn't do it on your own.
No.
And Doc, give the listeners an idea. In the last 6 months, you've had a complex surgery. On average, what length of time would a complex, I mean, you can't give us specific because it varies, but what was the longest surgery you've done in the last couple of months?
Usually the longest surgery I took for the last couple of months was about 4 to 6 hours. It was adult scoliosis. The patient was over 70. And this is the next thing. Many times, the complex procedures you have to do with older people, which is not really the ideal. But what tends to happen with older people, they have arthritis and degeneration in the spine, and the nerves or spinal cord tends to get compressed, and then they start to get weak and severe pain. And you start to realize, you will know as a therapist, people can't live in pain, no matter what type of it is, mental pain, physical pain, emotional pain. But these older folks, when they have arthritis of the spine called spondylosis, they have pain, a lot of pain, and the pain now and weakness prevents them from walking or even standing up for the most part. And you could imagine a life you cannot stand up or you cannot walk 5 feet and you're in pain every day. So that is one of the main drivers for surgery in the older patients. Once the spine is compressing on the nerves or spinal cord, causing severe pain, plus or minus weakness, most of the times, once they cleared for surgery, will need an operation, usually a complex type, because the spine is degenerated at multiple levels. So you have to deal with multiple levels, and that is what makes the surgery extensive. With regards to recovery time, which is what you asked, you have to think about the medical status of the patient, and you have to think about the ambulatory status of the patient before. So if it's that they usually tend to be, as you say, all the bad things, obese, diabetic, cardiac issues, so the heart output for energy is low. Diabetes make patients more prone to infection, so you have to try to prevent or treat it if it happens in and around the surgery. And then the muscles weak because they're sedentary and because of the pain, they won't walking around to even start with. So prehab is an important thing too. So the muscles are small and weak. They undergo a big, long operation with implants, and then the tissues take a while to heal because of the comorbidities like diabetes and heart problems and all that. And then you have to get, I involve therapists from before and during and after, perioperatively. I big on physiotherapy, right? You know that too.
Yes.
And that was part of the training in England as well. Therapists are important in getting the patient up from day one. I tend to mobilize my patients. Once they're not paralyzed from the injury before the surgery, I big on physiotherapy. Get the patient sitting up, and if they could tolerate the pain, standing up. So I do measures in the surgery as well, working with my anesthetist to have pain blocks and all these things to reduce pain, to get them up and about, because this lends to the other benefit. You want patients mobilizing well to get their muscles working and to prevent blood cuts and DVTs and pulmonary embolus and all these things. A morbid bedbound patient is a patient that over time would die from complications of long old age. Happens a lot to older people and patients who are paraplegic or quadriplegic. That's just the truth. So you want to prevent that. In terms of recovery time, and I'll stray a bit, basically it's based on the comorbidity of the patient, the muscle status of the patient before the surgery. So a surgery is not a miracle. If your muscles weak before and your bones weak, and you're not walking around before the surgery, you won't suddenly after the surgery die. So it's where the therapist and the diet and the nutritionist, the nurse, the doctor, the multidisciplinary team in getting the patient and mentally well as well. Sometimes I have to refer to psychiatrists too. To get the patients motivated, and the family also we involve to get the patient up and about, sometimes with aids like walking aids and frames, canes and whatnot, and with physiotherapist help to get them up and about in a safe fashion. So it could take days to weeks to even up to a year to see what a patient gets back in terms of the mobility. I usually tell patients a year if it's a complex procedure to see what is the eventual outcome. But I tend to get my patients up and about from day one after surgery. Once
and you said something there so important, and I'm going to do like the young people. I don't know if it clock it. Surgery is not a miracle. You have to be willing and able to do the work, especially with complex spinal issues. Because you also, I'm sure, Mr. Thomas, you also have to deal with patients who have waited too long.
Yes, that happens a lot. For financial reasons or cultural reasons, or they know somebody who do a surgery in the spine and get paralyzed. That is the number one thing it is here now. They say, Doc, I don't want to do the surgery because I know my neighbor do a surgery and get paralyzed. And when you ask them, what caused the injury? Was the patient paralyzed before? Silence. They're not sure. They just hear a thing. They're not sure and they're scared. But they're scared. If I have to get surgery, I'll be frightened too. That's why you have to go by the right people. Say prayers. I believe in God too. Once you get that guidance to go by the right professional or group of professionals who are trained to do it, you will generally have a decent, realistic outcome.
Yes. That is fantastic advice. But we also have that category of patients when you're finished with them. Doc, I feeling real good. I'm going back to the gym one time. And you have those, I'm sure. What would you say to these men, especially because remember we're talking about Caribbean men who have something to prove to themselves and the world?
You raise a good point. I had patients who they suffered for a while, had surgery, felt better, didn't follow instructions, and either went back out either to work too early, didn't listen to the physiotherapist and the doctor and the nurse advice about mobility instructions, sitting for a certain period of time, and stuff like that. Or, patients who they have a partner, so they were in pain, so they didn't get to do what we call married people thing or big people thing. And they felt so good after they went and do that too early and damaged themselves. So basically, patients, listen to your health care provider, listen to your surgeon, your spinal surgeon. Once you follow the advice, you will get back to some semblance of normalcy or your pre-morbid state based on the condition. But listen to the advice. Don't follow the layman who telling
That's
you,
right.
go ahead and just go back in, don't worry about that. No. Listen to the healthcare provider's advice
Right.
to the T, follow it to the T. If don't feel afraid, if you need mental support as well, you let your therapist, your doctor know so that they can get the psychiatrist involved. Because pain over a long time and suffering causes people to be depressed. It's true.
Definitely.
Or anxious or a combination, right? And mental health is the first part of healing, getting the mind in order to undergo the procedure and the treatment, and knowing that after surgery you have more work to do the therapist.
That's
The
right.
surgeon has hours during the during the consultation and the surgery itself, but the patient and the therapist, they have the real long distance race after. But prepare your mind to do it. And if you do it properly, you will get the best results.
Yes. Fantastic. I have a question here from a viewer who's asking about the possibility of having issues with sexual function, sensation, or even fertility when you have a complex spinal issue. Can you touch on that for us?
Yeah. It's also based on the pathology. If certain emergency conditions, and we call Cauda-Equina syndrome and its subtypes, usually affects the pelvic area, the sacral nerve roots, it affects bowel function, ability to pass or control stool, urine, which is this is a red flag, and between the private parts there, which is called the perineum. So certain spinal conditions, emergency conditions, like a herniated disc low down, could affect that. That will necessitate an emergency operation once it's diagnosed and confirmed with an MRI scan. So it's a clinical diagnosis confirmed with an MRI scan that would need surgical treatment once proven, right? Then the people might wonder if a surgery would cause incontinence. Once again, once you go by the proper surgeon who's trained, that should not happen. However, sometimes pain after surgery could cause urinary retention. That usually settles down with pain relief, catheterization, and whatnot. It resolves. Revision surgery, if all the nerve roots and whatnot is tied up and fibrotic tissue and scar tissue, it is possible it could happen. But the surgeon will talk to you about the pros and cons of surgery. Certain surgical procedures, like lateral interbody fusions and stuff like that, which I tend not to do since I'll be back here. I operate from the front to back, sometimes side. But if you go down by the lumbar plexus nerve roots there, by the psoas muscle, you could damage it. Or if you do anterior procedures, low down by the parasympathetic plexus, anterior lumbar interbody fusions, you could damage it in males and cause incontinence. So in a case like that, it's best that, it's a collaborative effort between myself and the vascular surgeons. But if there's another way to do it, I try to mitigate the risks and complications of surgery. So I do what's necessary and what's the safest possible option. So the answer to that is yes, there are some spinal surgeries that potentially could cause it, but in the arms of the experienced surgeon, that's minimized almost to less than 0.1% or less than 1%. But certain spinal conditions like Cauda-Equina, if that happens, you could get incontinence and things of the sort. Yeah, and the outcomes is variable between patients. Time for diagnosis, time for surgery.
Yes. Yeah. Thank you for that. So, Doc, let's have a little kind of fun. So I'm going to ask you a few questions and tell me if it's fact or myth.
All right. This will be good, yeah.
If I can still walk, my back cannot be seriously damaged.
That's a myth.
Definitely a myth. Back pain is just something you have to live with as you get older.
That's a myth too.
Yes, and I have it all the time because patients are getting younger. They say, well, that's part of it. No, just because you're getting younger doesn't mean you have to live with back pain. It's a myth. You heard it from Mr. Thomas himself. If I have a slip disc, I definitely need surgery.
That's not true too.
That's a myth for sure.
You can treat it with physiotherapy, yeah. Once more red flags.
We have to come choose the right physio.
Choose the right physiotherapist.
Choose the right physio. resting completely is the best treatment for back pain.
That is not true too.
And years ago, that was the treatment for back pain.
Yeah.
Like over 50 years ago. Lie down, rest.
Long-term rest. And the muscles just
Long-term
waste away and get weaker.
Correct.
An observation I made though in our society is that because of these myths, you know, with back surgery, and you're probably going to ask me, once you do back surgery, would you get paralyzed as a 50-50? I rush that one. That one a lot. But if we watch the older folks in our society, some of them, you would see they progress from walking independently to walking with a cane. They start to, the posture bends over time, and then they hobble, walker, wheelchair, and then they home and bedbound. But I think these patients should seek care too, and see, because many times it's from degenerative disease causing the claudication, and it could be treated with surgery. So people must, the children and the relatives and the caregivers, take the patient to the physiotherapist or doctor for initial, or healthcare provider for initial assessment. But I like the fact versus myth question. I like that.
And in our culture too, we have this thing as they're getting older, they need to relax, they need to sit. I always use the Asian countries as an example. I visited Hong Kong twice in the last 5 years and for work. And I went on 2 tours each time. And the initial tour was always by somebody over 70 years old. And their thinking is, if we keep these people active, we will have less burden on the health system. And
that is very true.
Yeah. So in Hong Kong,
that is very true.
They have better control now of diabetes by keeping the older population active. You have osteoporosis was a big thing. It's actually being reduced by keeping them more and more active and integrating them into society. So the tours that I went on were retired PhD history professors. You know, so they use their skill, but also keeping them
active. That's a real good point, because sometimes people might think the layman, or sometimes even people you'd expect more from would be like, why you want to operate on that old person? They're old, they're supposed to. And the answer is no. A grandparent, granduncle, grandaunt, they have an important role in our society. People our age and younger, they have kids. They're out working all the time, doing 1 and 2 jobs. The grandparents take care of their grandkids and keep the family running. They have to pick them up, drop them off. Sometimes they cook, they clean up, they caretake. They get to give a secondary love that they get to give to their grandkids that they didn't get to give to the kids. And then they're very active. They up and about. They go out. They have their people too. They're just a little older. So why limit or condemn the older folks chronologically to like a death sentence? That is, to me, is total. And you see the Asian countries thinking ahead. The European countries have the caregiver system, but I don't think they push getting the older folks out there. You could get them working and contributing to society in many ways, but they do it in our society. I think it's tailored towards family systems, and the grandparents are very important in our family system. And we cannot limit them and let them get sick and die a painful death. It affects the entire family system,
That's right. There's I can't remember, I think it was Holland, a project. It started as a project for a research paper, and it has morphed. I think it's Holland, where they have able-bodied grandparents working. I shouldn't say working, but they have them 3 days a week in daycare centers with the little ones, and they tell stories. They play with them, and there's this bond that has developed between little one and grandparents or older person. And they did it, I think, over a 2-year period. And what they saw was decreased incidence of dementia and related issues, improved independence in the older persons, and they're supposed to do some long-term studies where they're looking at even just the oral history of storytelling passing down from generation to generation, things that we take for granted. But all of these things help with the mind and the body of our older persons. And if we keep them more active, we'll be spending less in the long run. You know, if you have somebody severe,
I'm glad you touched on that.
Yeah.
Yes, it's true. So there's
all facets.
From all facets.
Yes.
So is from the personal benefit of is an individual and a human health and mental health and physical well-being. From the community and family, the family unit is important. You have a good family unit, you have multiple family units, you have a good community, you have a good country, productivity increases, right? And then you talk about the financial, you decrease the financial burden on the economy and your society.
Right.
So it's just like a win-win throughout.
Yes. This is fantastic. I wish we could stay longer, but I'm going to start reining us in a little bit. So I have a little rapid fire round. It's really brief. So just short answers. Don't overthink it at all. Yeah?
Right.
Ready?
Yeah.
Best everyday habits for your spine.
Walk around. Don't sit for prolonged periods of time. Avoid soft couch sitting, and do some type of cardio. Walk the steps instead of taking the elevator. Hydrate well and get your salts in. Eat well and keep your weight down.
Standing desk, helpful or just hype?
No, I think it's helpful because you'll stand for most of the time and you'll sit for less time. I think it's helpful.
Yes. One symptom a man in particular should never ignore with regards to their back or spinal health.
Any type of red flag symptom, so any type of urinary or stool incontinence, change in perineal sensation, new onset weakness, or severe pain not going away with normal over-the-counter medication.
This is fantastic. Mr. Thomas, it has been a pleasure, and I want you to talk to our men in a final message tonight. You know, we've had some men and the women who love them watching. And we have our man who's working, providing for his family, who's busy, who's saying, I'll deal with his back pain later. What would you say to that man tonight?
All right. Well, what I'll say to the men out there is that don't take your spinal health for granted. Don't take back pain for granted. Get it investigated by seeing either a physiotherapist or primary healthcare physician or GP or doctor or specialist for initial evaluation. Do not ignore back pain and take care of your mental health, mental well-being, and your physical well-being. And take care of your family and yourself too.
Dr. Thomas, Mr. Thomas, the Mr. who acknowledges his wife and his children. I have an even greater respect for you tonight. Thank you for lending us not only your knowledge, but your caring nature that came across in what you said to us tonight. And, you know, we're going to have him again. Somebody actually asked about scoliosis. So we're going to have him again on a show just designed to talk about scoliosis or curves in the spine. But thank you so very much. He had surgery today for hours today in San Fernando, Jen. Yeah. He also has his private practice. He has his family, and he is here. Again, we have the experts right in Trinidad and Tobago. So, Mr. Thomas, don't go anywhere. Just hold on a minute. Let me just have a little chat with the viewers, and I'll come to you shortly. So stay right there. So, everyone, it has been amazing. Thank you for logging on. Feel free to share this recording. Feel free to ask questions. I am going to post the clinics where all our specialists and all our professionals work. So for Dr. Parisram, Dr. Richards, and for Mr. Thomas, so that you can be in contact with them to get your health on track. It is not that I want you to go to the doctor. You have to, because it's about prevention, early detection, and appropriate management of whatever issue you are having. And today we spoke quite a lot about the spine to give you a better idea of all the processes that our surgeons go through in deciding what is the best treatment for you, in looking at how you can prevent back pain by ensuring you manage your weight, that you eat well, you keep hydrated, that you sleep for the appropriate amount of time. There's a lot. Take your time and go back and listen to the recording, and there's be much, much more on Real Time with Dr. Stacey, because we will be speaking to a psychologist next week. So look out for that information, because mental health plays such a major, major role in our well-being. And we are seeing in society today that so many people have issues with mental health, and we cannot shove it under the carpet anymore. So thank you so much for being with me. For all the people who said hi, Mr. Charles, Mr. Roberts, Chandra, I'm seeing Jillian, Mishka, and everybody else who's been online. See you very soon with Real Time with Dr. Stacey. Bye.